Okay, so come with me while I do a deep dive and an unbiased comparison of Baby Glow for Density 1 and Skinvive. So, when do you pick what and how do they differ and what do you do as a patient? Because I'm sure we've all heard recently about Baby Glow and then we still have OG Skinvive. So what do you do? Let me just tell you that these are both lovely treatments and probably do both. That's my opinion. But let's compare. So for Density 1, aka Baby Glow. This is an uncross-linked hyaluronic acid injection, and the new protocol is very specific, and the way that we do it is, I'm not going to draw my face, but there are 3 injection points in the apex of the cheek. There is 1 injection point right in front of here. There is 1 injection point in the lateral jawline. There is 1 injection point right here. There is 1 injection point right here. And the last injection point is here. So they have done an analysis and determined that these are the ideal injection points to increase reflectivity in the skin and to hydrate the skin. It is not a filler. It is not going to change the way you look and give contours or structure or revolumize, but it is going to increase the health of your skin. There are, it's hyaluronic acid, and there are vitamins and minerals in it, so it's not just hyaluronic acid. It's like hyaluronic acid and vitamins and supplements to your skin. So you need somewhere between 2 and 3 treatments, about a month apart. There is very little downtime, it's very quick, and it's quite painless. So this is Baby Glow. I had 1 treatment and I'm excited to do my 2nd treatment. It's a skin booster, right? But it's a very, very nice technique with very few injections. Baby Glow. Oh, I was rattling it so much. Skinvive. Skinvive is cross-linked hyaluronic acid. Now, what does that mean to the patient? That means that this hyaluronic acid is actually, the chains are holding hands, okay? So this hyaluronic acid is going to remain in the skin and continue to hydrate for quite a while. Uncross-linked hyaluronic acid will be gone after about 48 hours, okay? It does not survive, but the effects of it will remain. Cross-linked hyaluronic acid will survive for 9 months is what the study has shown. So with Skinvive, we draw a grid on the face, 1 by 1 centimeter grid, all over the face. It's great in here, in the upper lip, and this is 1 treatment. You need 1 treatment every 9 months, and we typically use between 2 to 3 syringes. Skinvive. Skinvive is glow, luminosity, helps with fine lines, obviously builds collagen, right? So hyaluronic acid, we know now, builds collagen. It's not just Radiescent Sculpture that builds collagen, hyaluronic acid also builds collagen. So you need 1 treatment for 9 months. You need 2 to 3 treatments for about a year. The price points are about the same when you compare. You're going to come back 2 to 3 times versus 1, so pricing is about the same. Less pokes, more pokes. Less visits in office, more visits in office. In my opinion, more of a glassy look overall. This is more of like glow and more of a natural, hydrated improvement in skin quality. My opinion is you do both. You do this 1 year and you do this the next year. because they're different. They're different, but they're similar. I hope that makes sense. If I've confused some of you, come in for a consultation and we can discuss this more and see, like, if you say have a month before an event, I would probably just do this because we don't have much time. But if you're, say, 6 months out before a wedding, then we have time for your 3 treatments, right? If you want very little downtime and you have a party that night, this. There's more risk of bruising with Skinvive because we have more injection sites. Come in for a consult. Sorry for the long video. We'll talk more.